Welcome, everyone, to the operating room edition of Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I'm joined with the ready for surgery, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I got my surgical cap on. I got my headlight on. If you can hear a low level of humming, that's the actual light source. You got to look on our YouTube channel, Jason Martin, MD. You can see we have our whole getup ready to go. The only thing I don't have is my surgical gown.
Or your mask. I don't have my hat on today because my hair's down and it doesn't fit. Like, that's why I always, if anybody wonders why I always wear my hair in a bun, it's because 99% of the time I'm leaning over somebody to take out stitches or we're in a case, so I have a surgical cap on.
Hence the reason for the surgical caps.
That's right.
Yep.
Keep the hair up.
And these lights are very bright. If you watch on our YouTube channel, I just blinded Nils' video.
Everyone.
Yeah.
Everyone is now blind.
All right. In the interest of a podcast, we're going to turn off the headlight so you can actually hear what we're saying. I'm taking it off too. That's good.
Remove the headlamp. So the reason we're doing this episode is because we've talked a lot about plastic surgery, reconstructive surgery, health and wellness. We've done a lot of podcasts, but one thing we've never talked about is what happens in the OR.
Which is everything that we do all the time.
It is. That's most of what we do.
So we've never talked about the operating room.
Yeah. So today we're gonna dispel myths. We're gonna talk about what happens. We're gonna talk about anesthesia. We're gonna talk about all the things.
We're gonna myth bust the OR.
Yep. So Sesame Street theme song coming in. Who are the people in your OR?
Who are the people in your neighborhood?
Yes.
So the one I remember from Sesame Street is like, which of these people is doing the wrong thing? Do you remember that one?
No.
Oh yeah, they would show like 6 like Brady Bunch tiles, people, and like 5 were firemen and 1 was not. Or maybe it's not 6. Do you remember that? Which of these people are doing the wrong thing?
I don't remember that
Maybe
one.
that wasn't Electric Company. Maybe that wasn't Sesame Street.
Oh, maybe.
Okay.
Yeah. Sesame Street was all about
We're going to
doing
get a
the
lot
right
of comments
thing.
on that. Then no one cares about the OR. They just want to tell me how it was wrong.
Oh, you're wrong about
Yeah.
that. So who are the people in the OR? There's a lot.
There's a lot of people. All right. So if we're talking about a standard operating room, okay, not Dr. Martin's in-office surgical suite, every OR that you go into will have a couple people in there. They'll definitely have some sort of anesthesiologist if you're getting anesthesia.
Yep.
You'll have a scrub tech. That's the person that helps the surgeon with surgery, hands them instruments. You remember in the movies, scalpel, and they put their hand out. That's the person that hands the scalpel over.
Handle first.
Handle first, not knife in first, which
That's your last day as a scrub tech.
I had a new trainee come in and do that, and I looked at her and I was like, "Are you serious? You want me to grab this?"
15 blade out.
There's always, and I think, and this is almost all cases, it's a nurse, is a circulating nurse or circulating person that it's not scrubbed in, it's not sterile, who's handing instruments to everyone, and that's the basic level.
Now, and they're keeping records too.
Keeping all the records and
doing the timeout.
Timeout if emergency occurs, whatever. They're the kind of lead in there to kind of make sure we're doing all the right things, and getting supplies, whatever is needed.
Yep, meds, especially like if you guys need something that's like in a locked cabinet, like they're usually the one that has the key, like so they can go get medication or something that's needed for the anesthesiologist or the doctor.
Right. So it's 3 basic people. Now in my operating room, unfortunately, I had the fellows. It's so wonderful to teach them, but they get me so frustrated. So and I don't let them do anything for all my patients who do cosmetic surgery. I just tell them what to do. In their careers. So you'll have trainees. And a lot of places that are university hospitals or major hospital systems will have residents. They'll have residents, and it may not be medical school. It could be a PA trainee or whoever. In my OR also, sometimes I'll have a surgical assistant. That's someone who helps me with the surgery. And sometimes, depending on the case, you'll have a rep from a company in the OR.
Device rep. Yep.
So I always joke about the orthopedic surgeons have like 12 reps in their OR rooms, and I think that's because they have problems with their confidence, that they need a lot of people watching them do surgery, whereas I only need at the most 1 rep. But that's just my own personal theory.
Yeah. And that could be, sometimes you do need a device assistant, let's say there, because a lot of times the device needs to be operated non-sterilely. So there may be functions on it, like even just now, like Nils turned off our OR light. Like that's something that your scrub tech is scrubbed in. Your anesthesiologist is making sure the person is breathing and alive. Your surgeon's scrubbed in, like who's going to turn off the light? Like your circulator nurse is busy keeping records. Like, so sometimes there is another person that's maybe operating a laser or you know, doing like something.
For example,
with a
the great example of that is like, there's a lot of surgical specialties that use x-rays. So you'll have the radiology tech come in and do the x-ray in the OR or operate some machinery. A lot of these surgeries are being done now with Da Vinci robots, which are basically they're robots that do surgery. And you'll have a Da Vinci kind of tech there just in case something goes down with the robot.
Yep. Or like when you guys use the SPY, like a lot of times there'll be a SPY rep there, which is a device that like tracks infiltration of tissue, blood supply.
So the way we're describing it sounds like a big party for medical people. It's really not. In most cases, you're going to have an anesthesiologist, a scrub tech who hands sharp instruments to the surgeon the right way. The circulating nurse or someone who circulates and gets all the supplies that is needed during the case does something called a timeout, which Amy referenced, which is say, is this the right patient? What side are we operating on? Do they have risk with surgery, risk with fire? What's their ASA classification, which is their anesthesia classification? How sick are they? That kind of stuff. And they're an extremely important job. They keep tabs on everything, make sure we're doing it the correct way and nothing's going awry. And then you have all the ancillary people. The more egotistical the surgeon, the more representatives they have in the operating room. I hope at some point some orthopedic surgeon listens to this randomly and they're like, who is this asshole Martin throwing us under the bus? That's okay.
So there's definitely a variety of people in your OR and they're all there for a reason.
Yep.
So biggest thing is that everyone in the OR has one goal in mind, and that is safety first.
Safety first.
And you see that in posters all over the inside and the outside of the OR. When you're scrubbing in, there's signs about patient safety. When you're in the OR, there are signs everywhere about patient safety and protocols that are all related to safety.
Just to get into the OR, you have to go through so many hoops. You have to get blood tests to make sure you don't have any strange infections in your blood. You have to have vaccines. You have to have training. It's not willy-nilly. I mean, it's a very controlled system for one reason alone, and that's patient safety.
Yes.
And that's all that matters to them.
Yeah, everyone in the OR, everyone around there, everybody who comes in, the doctor, everyone is concerned with your safety as a patient, first and foremost. And it's a pretty amazing thing to see. You know, most of what happens in the OR, the patient is obviously asleep for. You know, you might remember being rolled into the OR, but after that, you really don't remember anything. And it's pretty amazing to be in a surgery and to see how much care is taken of that patient from the second they roll in. The anesthesiologist is monitoring them immediately. Everything is prepped and draped for their comfort. We make sure that if someone has a special consideration that they need some extra bolstering,
like a joint, like a shoulder that's sore, or, you know, a leg. You have squeezy devices on your lower extremities, so it increases blood flow and decreases the chance of blood clots. I mean, there's so many different things.
The bear hugger, we keep you warm.
We keep you warm. We have a bear hugger is awesome because it's basically a raft that has holes in it, and they wrap it around your body, and then they run warm air into there to keep your core body warm.
Yeah, so we monitor the temperature the whole time, and that all gets moved around. So if you're having surgery on multiple areas of your body, like before we go on to the next area, like we move stuff to make sure that you stay warm, that you're secure. I mean, we strap you down to the table in a way that's comfortable and to keep you from falling, because the table can move in a lot of different directions. I
mean, in my OR, I actually position the patients myself and make sure all their extremities are appropriately placed. And I've never had a problem with that, in terms of having problems with pinched nerves and things like that. So, I mean, patient safety is the number one thing we're concerned about. And just for patients to understand, even though there's a hierarchy, like a surgeon is at the top, if there's a concern, like with the circulating nurse or the scrub tech or the anesthesiologist, there is methods in every OR to stop the surgery, even if the surgeon says no, right? So the surgeon is what they call legally the captain of the ship, but there is methods in most operating rooms that allow for dissension, especially related to safety concerns.
Yeah. And that could be there are obviously things that could happen during a surgery that the surgeon may not see happening. There might be something with the anesthesia equipment or something happening, in the rest of the hospital even, that the surgeon may be unaware of. So that circulator is really important in communicating those other issues to the surgeon as well. Like during a case, there may be things that they just don't notice because you're so focused. You're really focused. You got your headlamp on. You're looking down at one little spot.
I've got my surgical cap on. By the way, if you're watching on YouTube, we have one of our surgical caps in front of our computer that we use.
This is my surgical cap.
And it has a picture of me. Amy wears that on top of her red head.
Yes. So Let's
See,
talk,
I got those orthopedic surgeons beat.
right? We have our
my whole team
custom-
has pictures of me on their caps.
custom caps. So let's talk a little bit about anesthesia, because I think when people think about surgery, one of the main things that they're immediately concerned about is anesthesia.
And they should be.
Yeah.
Like the people that aren't, it's like, why is this not a concern, right? Because you seek out this surgeon. I mean, we're more talking about plastic surgery, but you could apply this to any surgery. You seek out a surgeon because of their skill and their reputation and maybe their reviews and all that kind of stuff. But how many people actually ask about who's the team? Who's the anesthesiologist there? Because the anesthesiologist is very important. We did a podcast recently on BIA, ALCL, and adverse events, like severe adverse events with anesthesia is 1 in 10,000 cases, which is extremely rare, but it's measurable. So you would want to make sure that you have a reputable anesthesiologist in there who has experience and knows what they're doing, especially related to the type of surgery you're doing.
Yeah, and we have a great podcast with Dr. Merrill. It was several years ago, but if you look back in our archives, I highly recommend listening to that if you're considering surgery or having surgery, because he talks a lot about the different types of anesthesia and why it's safe and how it's different than it used to be. It's a great podcast. It's a really good
most of
episode.
the stuff he talked about still applies. It was plastic surgery oriented, but it was still really good.
Yeah. So there are several different types of anesthesia, and I think the two most common ones that we use are either going to be general anesthesia, which I think most people are really familiar with, or what we call a MAC, which is monitored anesthesia, essentially, or you're not being breathed for lack of
but
a
you
better
have
word.
IV, like for example, the great example would be a colonoscopy where you get a medication through your IV, but you don't get a tube in your throat to help you breathe. So that's the difference. Most cases are done under general, but we're doing a lot more cases under MAC because it has a lower risk profile, not just related to harm to the patient, but severe harm, but like things after surgery like nausea and vomiting, headaches are much lower with IV sedation versus general anesthesia.
Which makes sense, because with general anesthesia, they give you sedatives that stop you from like muscle twitching and having like reactions to things. Whereas when you have a MAC, you can still have muscle twitching and some other things that may not help your surgeon.
Right.
So in some cases, like general anesthesia was as much as people think it sounds scary, like it's sometimes very necessary for your safety, again, for your safety.
When you're working sometimes on the face and the eyes, you don't want a patient moving around, which can happen with just IV sedation. One of the things not on this slide, if you're looking on our YouTube channel, is regional anesthesia, where you can do blocks. And Dr. Merrill talked about that in the episode on anesthesia. And we also talked about local anesthesia. To this point, when you go to so Amy, if your surgery is scheduled at 7:30, what is the common time you would have to show up to the operating room?
5:30, 2 hours is typical.
So I roll in at 7:15. Everything's done for me. They have markers waiting out. At my hospital, they have gum waiting for me because I like gum before surgery. And yes, I'm treated like a petulant child. That's okay. And everything's done. But these patients get there and there's a lot of stuff done. And the patients universally ask, like, why do they ask the same questions over and over? Do you have any allergies? Those what medications are you on? That kind of stuff. Do you know what surgery you're having?
Who's your surgeon?
Who's your surgeon? They're doing that for safety purposes.
Yeah.
Anesthesiologist. So first the nurse will come in and pre-op you and do all your paperwork, get you undressed, put the squeezy things on your lower extremities, put you in a gown so you feel vulnerable. It's kind of not a great situation in this sterile room or with just curtains around you. In some cases, we have rooms at our hospital. And then the anesthesiologist comes in. And by the way, just FYI, anesthesiologists aren't picked for their personality, okay? There's not some personality litmus for anesthesiologists.
No, there's so many jokes to be made about people who put people to sleep.
Right.
So
they're more comfortable with someone asleep. Plastic surgeons like people, that's why they become plastic surgeons. So don't judge the anesthesiologist on general affect and
or personality.
Yeah, if you could hang out with that person. You just want them to be reputable, safe, and smart, and good, and good under fire. So they'll come and see you, fill out a bunch of paperwork, ask the same questions again. And then I come in. And then what I do for plastic surgery is I take a Sharpie out or the marking pen and I mark all over you. And the patients always say, I'm so nervous. And my response to that is, I'm not nervous. And then I got you. We go back and then you go to sleep. So the anesthesia is a big component of surgery. To me, it's one of the most important components of surgery if you find a reputable surgeon.
Yeah, absolutely. And it's not as scary as people think. So definitely check out our episode on anesthesia to learn more, but it's not that scary. Here's the big question. Is it like you see on TV?
Yeah, it's like Grey's Anatomy. All the people are sleeping together. They're all young and attractive.
Right, there's an observation deck. Everybody's looking
at least
down at
one
you.
of the people has a drug addiction that's secretive, and no, it's nothing like the salacious stuff you see on TV. But what is like you see on TV is a team working together for one cause, and it's inspiring to actually work in an operative facility and to work with a team that has one unified goal of keeping a patient safe and facilitating a surgery. That's a real blessing that I have in my life that most people don't have. So I actually think it's a wonderful place. To be honest with you, I would prefer a lot of my life to be in the OR besides family time, because I love it there. It's my fiefdom. I have people there that support me. We listen to good music. I'm doing creative, awesome surgeries. Everything about it is awesome. The vibe is good. People are motivated. Most people in a surgical setting like their jobs. They may complain just like everyone else. It's long hours, but they know they're helping people and they're doing some good work.
Mm-hmm. And it's fun. I mean, you get to see cool stuff. I think two things that stand out to me in my time working with you are the times when I've had to hire someone. Now, this goes back a lot of years to when I was looking for a front desk person. And as soon as someone would say to me, my favorite show is Nip Tuck, I would immediately end the interview, which dates me, right? Because Nip Tuck was on a long, long time ago. And I think that was one show, though, that showed surgery in such a different way than what had been seen on shows like ER or MASH, going back really old. Like it actually kind of showed like this boutique-y view of the OR. So I will say this also is that it's not like Nip Tuck. We're not cutting people off of couches. We do play music, but we don't do it on that weird little remember they used to wave their hand over the CD player back when there were CDs?
I don't know.
Never watched it? No.
Never watched it.
Oh yeah, it was great. They'd walk into the OR and that was always the iconic scene. They'd their hand in front of the CD player that was one of those automatic ones, back when that was cool
That's
technology.
not what we do. Someone just takes their phone and plugs in their Spotify account.
And then we all fight about what music to
Yep.
play. Yeah. So it's not like Nip Tuck. It is probably closer to ER. And my dear sweet Canyon loves Grey's Anatomy. And I tried to watch it with him, but I just couldn't, because as soon as they'd get in the OR and there'd be people not scrubbed in, half the people in there aren't wearing masks. Nothing looks sterile. It would just make my skin crawl.
Watching shows for sterility,
dark.
So being sterile in surgery is probably the most important thing besides just being a good surgeon. Sterility is what decides a lot of outcomes, and that's why medicine, at least in these super specialized fields, are better in America than other places, because we have better facilities and adhere to better sterility. I mean, that's changing as the third world countries are growing and stuff, but that's why. So watching these shows is so insulting to anyone who cares about this kind of stuff. And their method of, and that they had some consultant, some surgeon in Los Angeles or wherever they are, go in and say, okay, you scrub like this, and you put your, it's never correct.
No.
So
it is. It's
the words are correct. They always say the right words.
Yeah.
So clearly they have a medical writer who can check all that. So the words that are coming out are pretty good. Actually, if you really want to laugh, you should. There was George Clooney was talking about, it was some talk show when he was on ER, that they used to put cards, note cards, on the patient. And he used to say,
so they're all looking down
oh
at
my
the
God,
person.
this might be a ventricular tachycardia. What is this rhythm? It's so hard. He's not responding to the atropine and epinephrine. Oh my God, we're going to lose this guy. And he was just literally reading it off a note card that was stuffed in this, actor patient. So
That's too funny. Yeah, but it's the one thing that stands out to me on TV, I guess specifically related to Grey's Anatomy, because I just couldn't watch it, was that it was always really dark in the OR, except for the overhead light literally above the patient, which is, there are times when an OR is dark, but it's rare.
Yeah.
If they're using a certain device or a robot thing that needs darkness.
Or laparoscopic procedures.
Then it'll be dark. But the OR, as you saw in the beginning, is very bright.
Very bright.
It is extremely bright. There is so much light. There's overhead lights. There's extra lights. There's other lights. There's headlamps. So much light. But unlike Grey's Anatomy, it was always dark and moody in the sides of the OR.
So every now and then when I'm feeling randy and the anesthesiologist is spouting out, I'll reach my head up and look over at the anesthesiologist and take that bright light and shine it right in their eye.
The curtain.
Yeah. Kind of
look at him.
Back at you, buddy. So
Yeah. I think I agree with Dr. Martin so much. Like if yes, you're asleep while you're in there, but just, it's important to know as the patient that everyone in there is absolutely concerned, very first and foremost, with your safety.
Yeah.
From the second you are rolled in to the second you're rolled out. I mean, even just transferring you from, the gurney or that you're rolled in on to the operating table and back. Like, I mean, it's a concerted effort. Like they'll call in extra people. Like we make sure that we move you gently, that it's all, we protect your spine, your limbs, like we throw more warm blankets on you. Like there's no shortage of warm blankets in the OR. So we are always looking out for your safety and making sure that you're safe and as comfortable as possible and that, you have the most positive experience possible.
I wish that other experiences in our lives would mimic the operating room. So my obsessive compulsive parts, like if you went to Costco, it was all taken care of like that. Like every step was just organized and you had a circulating nurse with you the whole time and the anesthesiologist and everything was just taken care of. And technically you were asleep. So I wouldn't have to worry about any of it. I would just hand them my shopping list and I would be wheeled through on a gurney, sedated, and everything would be taken care of. At the end of it, everything's already paid. I'm at my car. Everything's tucked into the car, and I'm getting
right. Your trunk
home.
Is loaded, and you're sitting in the driver's seat.
Exactly.
And we wake you up.
Probably not appropriate post sedation
to drive.
And that's something on the day
your driverless car.
The day of surgery, if you get any kind of neurotropic drug, any drug that affects your sensory ability, you will not be able to drive home. So you would have to have a family member or a friend take you home.
Yeah, you cannot leave by taxi.
Can't leave by taxi either or Uber.
No.
And think about that. People are like, why? Why is that? Well, would you want to put your friend who is compromised mentally into a car of a person you've never met?
And potentially in pain.
Right.
Yeah.
Who could have some medical issue on the way home. Would you feel comfortable doing that to a loved one or a friend? No, right? Never. So again, it always goes back to the patient's safety and caring for the patient in the appropriate way. What else?
That's it.
Yeah.
We listen to fun music. It's not like Nip Tuck.
So what is your genre for the operating room of music?
Oh gosh, it depends on the case. But I typically like 90s hip hop just because it's like upbeat and happy. When we do cases with patients awake, we usually ask them what they want to hear. And sometimes it's challenging to listen to. With Lexi, our favorite scrub tech, we always play Ed Sheeran. Sheeran. I always say it incorrectly, and she always laughs and never corrects me and just laughs at me because she thinks it's funny. So we listen to a lot of Ed Sheeran. Nil says yes. Ed Sheeran when Lexi's here. I like listening to 90s music I can sing
Nelly,
along with. Yeah, if you want to go and
stuff.
take a ride with me. And there's definitely good music for lipo when it's upbeat.
I have to say, it changes per day, and I like to let people choose. I definitely like 90s grunge. I like 90s hip hop for sure.
Grunge can get a little heavy sometimes, though.
Sometimes, if I'm feeling loose, I'll listen to 2000 pop music and that early 2000s with Britney Spears and stuff like that.
See, that's because Dr. Merrill loved the T-Swift.
Yeah, Taylor Swift. I mean, it just varies. And then, of course, being in Colorado, you listen to Avett Brothers and all that kind of alternative banjo moody music.
Well, my favorite was recently we had a training where we had 5 or 6 doctors here, and Dr. Martin walked into the OR and he said, "Turn on hip hop barbecue."
Oh, hip hop barbecue is the best station ever.
And I'm like, okay.
You're laughing, Nils. It's the best station ever.
So I did, and my version
for all the listeners, when you get done listening to this podcast, listen to Hip Hop Barbecue
on Spotify,
or even Apple Music. For some reason, Hip Hop Barbecue is pervasive on any music player. It's everywhere. It is literally the best. If you are over 30 years old, maybe 35-ish.
Probably 35.
Yeah, it is literally the best mix of music ever.
But the funny thing about this was also I put on the Hip Hop Barbecue, and I know what's coming. And there were a few times we were doing a training, so there's a lot of kind of chaos. There's a lot of doctors, so I'm kind of in and out. We got Lexi scrubbed in with you. I'm in and out of the OR, and I kept coming in, and the music would be on. I'm like, all right, that's fine. And every time I would come back, or I'd leave, Lexi said to me after, she's like, every time you left, she's like, the dirtiest songs came on. I'm like, right. Yeah, I could hear them because I had it playing in the speaker up front as well. So I'm like, yeah, I know, Lexi. I'm like, but that's what Dr. Martin wanted today, so that's what's playing.
I do think that, for me at least, I ask patients even when you're asleep, you want music to be on that they would like.
Yeah.
Because I think that somehow that would get into their brain, even though it's compromised at that point. So we wouldn't play 90s hip hop barbecue, whatever, if the patient likes certain types of music. Ones that classical music, which I like, and opera, which I like, are not the best in the OR because most people don't like those kind of musics, and you want musics for the team, right?
Yeah.
So imagine that you're running one of those marathons where you like everyone does a leg, and you have to pick your music and your playlist. So it has to be something that draws the whole crowd in.
Yeah,
So
that's true.
I'm kind of a little bit of a DJ. I don't want to, I'm a surgeon and a DJ.
And radio master.
Oh, I do. I do my surgery and then I mix it up afterwards with one of those mixing boards.
That's Dr. Martin's special equipment in the OR, his mixing board.
So that's really it. Just know that the operating room is a safe place. Also know that if you have a practice like mine, you have a team and the team's awesome. And hopefully that team is someone full of people that the surgeon wants to work with. And I have that, and I feel very fortunate. I love going to the operating room. It's my happy place. Again, I wish other places could just be like the operating room, and then I could go home and hang out with my family, but I only get that a couple days a week. It's when in the operating room, you're monitored the whole time and you're kept comfortable. And those are the two things that I think people get concerned about with surgery. And afterwards, if you go to a reputable place, a good hospital like the hospitals I work at, the recovery room nurses are great. You're going to stay there for a couple hours afterwards, and you're going to have a family member or friend drive you home. That's about it. Yeah. We'll listen to some good music while you're asleep, so hopefully it seeps into your brain, and maybe afterwards you're humming the song and you don't know why. And then the follow-up, it depends on what kind of surgery you had. A couple weeks. Sometimes for us it's a couple days. Depends. So that's it.
Yeah. Well, thank you everyone for listening to this episode of Beauty and the Surgeon. If you'd like to watch it, there wasn't a whole lot of interesting things to see, but you'd get to see the headlamp and my fantastic Team Mod surgical cap. Team Mod, because Dr. Martin modifies everything. So it'll be listed as a tummy tuck, but it'll be like, well, actually what we're going to do is fill in the blank.
You got to keep them on their toes.
Yeah. So everybody knows that they got to be ready to
work,
dodge and adjust as needed for Dr. Martin.
Blue collar.
Yes. Check us out on YouTube. We're at Jason Martin MD. On Instagram, we're at Beauty and the Surgeon Podcast. And also at Jason Martin MD on Instagram. Be sure to give us a comment, a like, a rating, a review. Send us your questions. We'd love to hear what you guys want to hear more of.
Yeah, we love questions. We love questions. So send what you can. Rank and rate us. It's all good.
Thank you.
Go listen to some hip hop barbecue.
That's right, hip hop barbecue for the win.